One of our big concerns is this major increase in mental health and self-esteem issues in education and in schools. And a combination of what's happening outside of school and what's happening in school. There's been changes to the education system, so there's more pressure in school for the students. So our programme, the idea is that we build resilience and we prevent the issues that they have at a young age from escalating to something much, much worse later on. So what we are advocating here is we can come in, work with students aged 13, 14 and actually prevent mental health issues from escalating.
The Wallsend Children's Community is one of 3 national pilots being supported by Save the Children. We have 3 key aims. First key aim is to intervene early and to get things right early before they become big issues. The second is around health, both physical and mental health. And the third is about supporting young children's aspirations. This project clearly fits in to the first of our key aims because it's about early intervention and sorting out mental health issues before they become CAMHS property, if you like. The second issue clearly has mental health in the title, and again that's going to fit in very nicely. But I think it also fits into all our aspirations as well. That's supporting aspirations of young people. That's also probably a key aim of this particular programme.
What we decided to have a look at was some very specific clinical measures. One of them was a child-specific anxiety and depression score, and one of them was very specific to self-esteem. We completed those prior to the group programme and afterwards. Prior to the group programme, what we found was that 4 out of those 10 girls showed clinical diagnosis for anxiety and depression, and 1 showed a borderline score. With regards to their self-esteem, all showed symptoms of low self-esteem. At the end of the programme, what we found was that only 2 of those girls remained within a clinical diagnostic category for either anxiety or depression, but that actually their score had significantly reduced. What we found as well is that all 10 girls presented as subclinical when it came to low self-esteem at the end.
This programme should definitely continue. We have got the skills and we've got the professional capacity to have an impact on many, many more teenagers. And we feel that raising their self-esteem and building on this programme and developing programmes across the region of the North East and across nationally would really, really benefit lots and lots of students, and it would improve their lives and the lives of the people that they actually interact with on a daily basis.
I think it's absolutely essential that we all take very seriously the issues that young people are going through. I have been absolutely amazed by the impact of this particular intervention, that after a relatively short period of time I can see massive differences in the young people, in how they feel about themselves and how they feel about one another, and how they are now reacting back in class to essentially be more resilient and have those coping strategies.
I would love to see this continue in a number of different situations. I think mental health is a massive problem, not just with young people, but a massive problem in society. And the young people who have mental health issues today are going to grow up into adults with mental health issues, and that's going to have a massive impact on the NHS. It's chronically underfunded. If we can nip this in the bud now, not only is it saving those young people from sometimes a lifetime of misery and worry and anxiousness, it's also saving the NHS a lot of money in the long run.